Dry eye is something that affects many of us. Lots of people visit their eye doctor annually to find out about treatment for dry eye. Our tear layers are made up of three different components. That's water, oils, and mucus. And in order to have a healthy tear film, those three need to exist in balance. And when we start to have a deficiency of one of those tear layers, that's when dry eye occurs. So things like quick evaporation of tears due to a deficiency of one of those tear layers, or low production of tears due to a deficiency in those tear layers will usually be the reasons for why we have dry eye. So the key to treating and recognizing dry eye is to know what the symptoms are. So oftentimes a patient might come in complaining of burning, a bit of redness, sore eyes, feeling as if their eyes are always watering or they're always in and out of focus on the computer or while concentrating. Those are actually quite common symptoms of dry eye that sometimes get confused with other things, or somebody's thinking that there's a bigger underlying problem. The important thing is recognize these symptoms, come in and see your optometrist, have your eyes checked so that we can further test and sort of diagnose those symptoms and see if it is truly dry eye. So there's a lot of patients who are at risk for dry eyes, and sometimes that risk increases with gender. Women over 40 are generally a little bit more susceptible to dry eye. And a big risk factor is environmental conditions. So again, living in a dry climate, even within your home, having ventilation that is circulating dry air, those sorts of things will affect how dry your eyes are. Also, it can be sort of your everyday lifestyle. Do you work on a computer every day? Are you staring at a screen for several hours throughout the day? Those will generally cause dry eye to be more likely within your eyes. So by seeing your optometrist, you're actually coming in to have a few tests done that are going to measure sort of how the integrity of your tear film and how quickly your tears evaporate. So there's several different tests that we can perform to measure the quality and quantity of your tears, because that will help us determine how best it is to treat your dry eye. I think it's quite important for patients to come in if they're recognizing any of these symptoms with grittiness, discomfort, burning, redness with their eyes. Come in and see your eye care professional, because we can diagnose and treat the symptoms before it escalates into a bigger problem.